Ladies and gentlemen, please welcome Hannah Vaughan Jones of Incisive Health and our esteemed panel.
Good morning, everyone. Thank you so much for joining us, and it's a real privilege to be in your company here at Concordia. I always try to approach moderating by looking for the things that we have in common. So things we have in common. We're all getting older. We're all living longer. Don't worry, it's a good thing. And what else we have in common is that we're all seeking a quality of life that complements that older age as well. Every society, of course, needs economic health policies that will take care of us as we age without being to the detriment of everybody else in that society. So how do we then harness the wisdom, the power of healthy aging for all of our economic gain? In this session, we're going to be looking at what needs to be done and also at what is being done right now to try and develop age-forward, age-progressive economies. So my panelists are Dr. Ashwin Vasan, who's the New York City Health Commissioner. Great to have you with us, Ashwin. Dr. Debra Whitman, who is the Executive VP and Chief Public Policy Officer with AARP, the American Association of Retired Persons. And last but not least at all, Lars Hatenstein is the global co-leader and co-founder of the McKinsey Health Institute. Deb, let me kick off with you, if I may, and the issue at stake here, brain health as we get older. Why is it so important that we promote brain health for wider society economic benefits?
Well, let me start a little bit with the bad news.
Okay.
And that's the
We're
numbers.
not getting older?
We are getting older, but that's okay. That's not the bad news. The bad news is that the number of people with Alzheimer's disease is expected to reach 14 million by 2050. That's up from 8.5 million now. And that's just Alzheimer's. There's all kinds of other types of dementia, Lewy body's dementia and others, so that the numbers are increasing. There's disparities across the population. So African Americans are 14% of African Americans over age 65 have Alzheimer's disease or related dementia, compared to 12% of Hispanic adults and 10% of white adults. And another bad point is it's expensive, not just to the families who have to suffer, but also the costs of Alzheimer's disease are extremely high. It's one of the most expensive diseases in the country. The annual spending is over $81,000. And so that means the total cost to Medicare and Medicaid and private insurance is over $290 billion.
Wow.
So the good news,
oh, good.
We have to go there, is that there's things that we can do to actually reduce our personal risk factors and reduce the risk factors across society. So this is not a demographic destiny, but we can change the trajectory through prevention, which a lot of people don't think about when they think about Alzheimer's and dementia.
And Ashwin, when you hear stats, data like that, how does that then shape the policies that you put in place and really kind of like develop those policies long-term and short-term within New York City?
Yeah, it's a great point, and thanks for having me here. Brain health is social health, and we know that social connection, loneliness, and isolation are risk factors, or at least isolation and loneliness are risk factors for more rapid progression of cognitive decline. There's plenty of research to show that if you don't have human connection and both verbal, physical, and nonverbal communication with other human beings, your cognitive function is impaired. So for older adults in New York City, our focus is where do we build the social infrastructure to bring people together to maintain social connection and stave off cognitive decline. But philosophically as a city, we know that healthy aging, healthy brain health through healthy aging starts well before one gets to the arbitrary cutoff of 65, which is more of just a policy function than anything else rather than a biological one. And that means we need to be looking seriously at a prevention agenda that invests in averting and redirecting the curve of the vast majority of preventable illness and death in our city, which is why we launched Healthy NYC, our population health agenda for the city of New York, focused on extending lifespan and improving health span by basically dealing with about 70% of the preventable causes of death in our city. And if you invest systematically in things like screenable cancers and cardiometabolic diseases and suicide, overdose, and other causes, you will not only extend a person's life. The majority of preventable deaths before age 65 will obviously contribute to longer lifespan as a whole, but you start to put into place the social connections, the access to care, and the physical health needed to both age healthily from a brain perspective and a body perspective. And so we fundamentally believe that healthy aging starts far earlier than simply addressing the needs of older adults today.
And Lars, I want to come to you. I'll come to you in a second if I may, but Ashwin, if I can just ask you another question about that. When you're looking at the broader public health goals that you have for the city, do the policies that are focused on and the aging population and brain health, do they fit in with those broader goals, or do they work against it? Is there a clash?
Oh, no, not at all against. But what we must pay attention to is that we are trying to extend lifespan and improve health span. Mm-hmm. And what that means is the quality of our years. We're adding life to our year. We're adding years to life and life to those years, right? Yeah. That old phrase. But when we mean life to those years, it really is the quality of the social, emotional, and physical connections that people have with one another as they age. And too many New Yorkers, older New Yorkers, are aging alone. Mm. While we might be on top of each other in this most large, dense city, we have some of the highest rates of loneliness, self-reported loneliness and social isolation of any big city. And some of that is modern life, some of that is unique to New York. So our focus has been on social infrastructure and building the places, the destinations where people can connect. Those actually end up having broad-reaching effects, because those same older adult centers that we build are also centers that we can use for intergenerational programming. Mm-hmm. We are tackling the effects of climate change. We know that severe heat, extreme heat, kills about 350 New Yorkers a year, the vast majority of whom are older adults who are socially isolated. So we created Be a Buddy, a program where we pair a younger New Yorker with an older New Yorker, and during our elevated temperature, extreme heat events, they check in, and they make sure they're either getting to a cooling center, have access to air conditioning, all to prevent entirely preventable death and disease. So no, not at all. This is not in contradiction at all.
Okay, thank you very much. Lars, let's look at the research then. Tell us about what the research is telling you at McKinsey now about the scale of the problem, which has already been highlighted to some extent, and also, the tech solutions that are coming around the corner that could help mitigate it.
Yeah, thank you. So the McKinsey Health Institute has a mission to really look at catalytic interventions on underinvested areas of health. So this topic here is really at the confluence of much that we are doing, and focus areas that we have include things like brain health, healthy longevity, and healthy cities. And all of those come together in a topic that we have set for ourselves to discuss today. Let me maybe first, from an innovation lens, comment on both what the two of you have said. We went into Alzheimer's and dementia. So just to highlight in innovation to give some hope also, and areas of opportunity that I'm excited about. There's a consortium called AD Riddle of 25 organizations that we're also closely talking to, that are public and private sector organizations led by Gates Ventures and Karolinska, and they've set for themselves as a goal to revolutionize the detection, the prevention, and the treatment of Alzheimer's. And the way they're doing, the one core element of this is really to use and have cognitive assessments, digital cognitive assessments, biomarker-driven and blood-driven biomarkers early on the pathway. So we pick up folks much earlier, and that's absolutely critical to mobilize wherever we can to do something about it. And the goal is there within 5 years to have that in 5 different countries, and really have it integrated in the pathways. So that's a great kind of something that can be scaled then beyond. And just a little bit on Alzheimer's in terms of innovation, something exciting that we see. And then Ashwin, healthy cities, or cities are really an under-leveraged lever to do something about health, right? And the innovation there, ensemble, everyone could say Ashwin, in the sense that according to our research, only about 1/3 or a little more of the big cities of the world actually have a top-level official that is looking at health. So there's a need for systemic innovation that the city kind of governance across the world actually reflects the importance of health. So the kind of interventions that Ashwin is talking about is actually becoming a standard, because at the moment it's not. Cities do not, as a standard, have health as a priority. And so therefore, and we are seeing great examples just in terms of the aging situation. In one of the fastest aging cities in the world is Seoul, where they, for example, have a great matchmaking mechanism where older adults can find opportunities to engage, and all that is, in quotation marks, all that is needed is with engagement of the city, is to provide the opportunities for these matches to be found. So therefore, that's contributing to health, is contributing to society, and it is contributing to brain health.
I want to ask about the tech partnerships, the partnerships in general between like public-private sector that you're all kind of like adopting and adapting to. But Deb, I want to ask you in particular now about, we're talking about Alzheimer's, about dementia as well. In your book, you've got a new book out, which is called The Second 50, and you say the number of people living with dementia is increasing, but the chances of us getting dementia is decreasing. It sounds like an oxymoron to me. Just to explain that.
Yeah, so the aging population is growing. We have more baby boomers aging. So the number is increasing, but the rate is lower, mostly because the baby boomers have higher education, which is protective, also have healthier behaviors. And so, many people, in fact, half of all Americans think they're likely to get dementia, when only about, sorry, I have to use my numbers, only about 15% of people between 75 and 79 actually have even mild cognitive impairment. So we overestimate this likelihood. And I think what we heard from my colleagues here is how much we can do to reduce even those numbers further. So if worldwide, you can reduce over 40% of dementias through both individual behavior and things like reducing air pollution, where cities and communities can have a huge role. So things that you can do yourself, I'm sure a lot of people want to know: get good sleep, eat healthy food. These are not surprising. Exercise. What's good for your heart is good for your brain. Be socially connected. Isolation is the same as smoking 15 cigarettes a day. It's bad for our bodies, it's bad for our minds. And continue to challenge your brain. So they're doing those types of things, healthy habits, you can reduce your risk factor by up to 1/3. That's not to say that nobody will ever get it if they exercise and eat right. And so even as you're aging, you should do cognitive assessments, and you should check in with your doctor if you notice any changes. Earlier this year, my father started seeing trees grow out of the wall and people that weren't there. And it turned out that he had been prescribed a new drug, and it was having a serious impact on his cognitive ability. Mm-hmm. So sometimes, my heart first went to Lewy bodies dementia, which is a horrible disease. But we were so lucky that once he came off this medication, he was fine. So there are things that you can do. And even if you get the dreaded diagnosis, I spoke to the head of National Black Dementia Minds, and she told me, your life isn't over that day you get your diagnosis. There's still a lot of capacity that people have and can still be productive in their communities.
I don't know about everyone else here, but talking to everyone about getting good sleep when you're got a room full of jet-lagged individuals. But anyway, Lars, I know you wanted to pick up on what Deb said.
First of all, Deb, thanks for sharing this practical advice that we should all heed, and think about how we can create ecosystems to better follow it. I think there's also, in addition to that, another fascinating area of opportunity of a field that doesn't even have a proper name. It goes by healthy longevity, life science, longevity science, geroscience, biogeroscience. What is it? It's basically the idea to intervene with biomedical interventions in the aging process, thereby delaying many of the symptoms and increasing health span over time. So now, this is an area where the investment has increased about 4 or 5 in the last 10 years or so, in the past 5 years, and the pipeline of innovation has doubled. At the same time, if you look by any reasonable estimation at the disease burden that is addressed there, and the size of this field is about a hundredth of what it is, because of course it is very early. It's an underinvested area, and there are, I think, many reasons to think more about how to this field as well, include that in the areas of opportunities when we think about healthy aging. And I just learned earlier that some of my co-panelists, like Debra, is also convening around this in December, which I think is very important.
Yeah, fantastic. Ashwin.
I want to pick up on something that's, looking at the title of this, the session, and something we haven't really talked about as much in this panel is the structure of our economy and the structure of how we pay for our health in this country, at least, and certainly as opposed to other countries. You all know we spend about 18% of our GDP on healthcare, on health, with only about 3% of that going towards preventive activities. We're estimated to be about 25% by 2030, potentially closer to 40% by 2050. Those are all CBO projections. That's an unsustainable track for any economy, any society. And the bulk of that spend is on our 65 and older population doing reactive things, extending life in hospitals, providing advanced care, the cost of drugs that I know AARP has been so fantastic about driving down the cost of prescription drugs in this country for older adults. But we've got to have a fundamental frame shift in shifting the gradient of spending, not only towards more prevention, but towards earlier years. Those later years will be far less costly, far more healthy, far more socially connected, better for brain health, if we are investing in prevention much earlier in life. Starting from day one, frankly, but particularly in the very clearly avertable, preventable diseases that are taking too many people too soon and blunting American lifespan, particularly as opposed to our OECD counterparts. We are 32 out of 38 in the OECD. We are 60th in the world. I'm giving you a particularly American view. I know there's a lot of people from all over the place. But I'm saying this only to get us thinking about not just the innovations, not just the science, not just the individual activities we can do. I'm a policy guy, so I'm thinking about how we can restructure our incentives and our decisions. We've got to really bring a fiscal and economic conversation around what's delivering return. Not return on our long-term economic outlook, but return on health. And we've got to spend more on prevention. We've got to spend more in our earlier years, so we're not spending so much on the back end, extending poor quality life.
And we need to look beyond the 10-year budget window of CBO, because these returns are for decades afterwards.
Yeah.
The economic argument seems really clear, but the stigma still persists around investing in older communities, older people in our societies as well. Can you beat the stigma with policy?
Which is sort of maddening, because it's essentially discriminating against our future selves.
Exactly, because
right?
we're all getting older.
Because we're all getting older, and so the failure to put in policies today that will protect older adults is the failure to protect ourselves when we become older adults, and wishing it were so, or wishing it were different. And that means offering opportunities for older adults in the workforce. That means opening up better access to care and lowering prescription drug costs and other healthcare costs. But it fundamentally means making the process of aging easier earlier, putting into place things like support for mobility, for better transportation, for green space, for exercise, for healthy foods, all the things that we work on core in public health, but haven't historically linked to longevity and aging, which is why Healthy NYC is very much that foundational public health plan, which we've now also codified into law. So it will last long beyond me or anyone else, to set us up for better brain health and set us up for better aging.
We've got about 30 seconds left, so I'm just going to ask you quick fire answers on this. The takeaways that you would want the audience to take away now on how older people can continue to live longer in terms of quantity of years, and also live better in terms of quality of life as well. Lars, to you first.
just to quickly pick up on Ashwin, I think to get that kind of shift, it needs to really be a priority once there's no war and peace talk and climate as a top priority. It needs to be on that level. Otherwise, that kind of transformation will be a challenge.
Thank you. Deb.
I talked about what individuals can do because we do have a lot of power, but I also want to make a pitch to the private sector that it's a huge and growing market. Over 50 cents of every dollar will be spent by somebody over age 50, and we're working with companies and our innovation lab to get them to help solve these problems. We need to make aging easier for everyone, and we need to start at a younger age.
And final word to you.
Yeah, I'll pick up on that. Public-private partnerships are key. The best thing about Healthy NYC is that we have over 20 private sector organizations who are saying those aren't just the public sector's goals, they are our city's goals. And the more we set those agendas out, the more we'll see the private sector come in. We need you at the table innovating, but we also need you backing us in your communities with your employees and ensuring that your employees are aging healthier, which is also better for your bottom line.
Mm-hmm. Thank you very much. Final word to me, then, that is to say that Deb has got her book signing taking place in the Members Lounge just across the way, straight after this as well, so you can find it
And the books
there.
are free.
And the books are free, of course, as well. Please join me in thanking my wonderful panelists for this, to Ashwin, to Deb, and to Lars. Thank you.